Namaste. Hamisha खुश रहिए. I am Dr. Anchit from Jyoti Vidyapeeth Women's University from the Faculty of Physiotherapy and Diagnostics. The topic that we're going to study today is fractures of upper limb. Fractures of the upper limb. So we are going to study about the most common fractures of upper limb, their treatment and possible rehabilitation. To start with, we start with the fracture of the collarbone, that is the fracture of clavicle. It is the most common bone to be broken. It is very common in children due to many falls. Lateral fragment of the clavicle is displaced downwards, forwards, and medially. The symptoms which are present in the fracture of clavicle is local pain is present, tenderness is present. Patient supports the affected limb with other hand and tilting his head to the front side, which is evident in the picture. Treatment is surgical is reduction or conservative is figure of eight shaped bandage. Complication is usually malunion, which is visible here. Operative treatment indication is non-union, neurovascular involvement, that is any kind of nerve involvement during the fracture. A persistent wide separation of fragments, that is multiple fracture. Second is fracture of scapula. Usually there is no displacement of the scapula, supported by the muscles of both sides, so it prevents any displacement. Treatment is very simple. That is, we put in the arm sling for at least 3 weeks, depending on the severity of the fracture. Investigations for the operative treatment is floating shoulder. Floating shoulder is a syndrome in which the shoulder appears to be floating, as in it doesn't appear to be stuck through a joint or a major displaced glenoid fracture. Then again, a very common fracture is the fracture of humerus. That is the major bone of the upper limb. The proximal humerus, there are many parts where the humerus can get fractured. The proximal side is the neck can get fractured or the tuberosity, the greater tuberosity. The shaft can also get fractured, and in the distal humerus, there are supracondylar fractures, intracondylar fractures, medial and lateral epicondyle fractures. So there are a lot of kind of fractures present in the bone. The reason for the many fractures is because it is a very long bone and it has many surfaces and planes. So any part can get fractured. So depending on that, the number of fractures are presented here. For surgical neck fracture, it is the most common fracture and severe also because a lot of musculature is present around it, as well as arteries and nerves are present. So treatment is impacted strapping. Impact strapping is tight strapping around the thorax, and reduction is also done in case of proper fracture. Surgical reduction with fixation with the help of K-wire, plate and screws, and intermedullary interlocking nail when the fragments are separated. And for fracture shaft of humerus, the treatment is dry conservative treatment. Conservative treatment is the same, the bandage, tight bandage. Unstable oblique or communicated fracture may open reduction internal fixation. Open reduction internal fixation is we have to open, expose the bone, reduce it with the help of reduction means fixing with the help of either nail or plate or rod or screws or K-wire. Then there is interlocking fixation of humerus. The most important complication is radial nerve injury. As I just told, it is a very vascular structure. The nerves go around the bone. So, in case the nerve is also damaged, it is presented with a wrist drop. In supracondylar fractures, which is most common in children, again due to falls, which can be both extension or flexion types, clinically presented with pain, swelling, you can see in the picture. Treatment is urgent reduction plus slab. Urgent reduction means the bone is joined together with the help of either K-wire or screws or rods, and then a plaster is put on. If it is unstable, then again open reduction internal fixation with the help of wires. In adults, it is treated only with ORIF with plates and screws. This is how it can be have multiple fractures. Complications are the most common complication of any fracture is malunion. So malunion में there is a altered carrying angle that is cubitus varus or cubitus valgus depending upon the malunion. Joint stiffness leading to contracture due to adhesions and malunion. This is a picture of cubitus varus. You must have encountered in children sometimes. Vascular complications include acute ischemia due to vascular injury, edema, and tight cast. Management of the ischemia is urgent reduction of the fracture, release of the tight cast, systemic vasodilators to improve the blood circulation, and if there is no improvement, then of course surgical exploration. Volkmann's ischemic contracture. It is a fibrosis of deep forearm muscles due to prolonged ischemia. Ischemia can be again due to fractures or due to any tight cast. It leads to fibrosis of the muscles, leading to a kind of claw hand type formation. Treatment is surgical excision of fibrosed muscles plus tendon operations. Intercondylar fractures, it can be either T or Y shaped. Interarticular affecting the joint surface. Treatment is again open reduction. Fracture of the humeral condyles. There is a avulsion fracture. Avulsion fracture is that whenever there is a fracture, uh, the tendon, a part of a tendon chips with a part of bone. This is a kind of avulsion fracture when a part of bone is chipped with the tendon or cartilage. Treatment is ORIF by K-wire. Fracture head radius is intra-articular fracture. Treatment is by large fragments. Communicated fracture may there is an excision or arthroplasty and head prosthesis. Fracture of olecranon. Olecranon fracture is presented with interarticular fracture. Treatment is again by reduction, band wiring, and plate fixation. Another common fracture of the forearm is Montague fracture or dislocation. This is the upper one-third forearm fracture in which presented with upper one-third ulna plus dislocation of superior radioulnar joint. Type can be extension type, flexion type, or lateral type. Treatment is again open reduction internal fixation of ulna. Galizy fracture. Galizy fracture is a fracture of the distal third of the shaft of radius and dislocation of the distal radioulnar joint. It is just the opposite of Montague fracture. In Galizy fracture, the distal part is fractured of radius. In Montague, the upper part or the proximal part is fractured. Treatment is again open reduction. Fracture of both arms of forearm in children usually green stick treatment. That is the close reduction and above elbow class fixation. In adults, it is again ORIF. Complication is as usual malunion or cross union. Cross union is more complicated than malunion. This is fracture of both the bones. This has been treated. Colles fracture. Colles fracture is a fracture of distal 1 inch of the radius with or without avulsion of the ulnar stelloid process. It is common in old age due to osteoporosis. Displacement of the distal fragments backwards or upwards and laterally. And clinically, it is presented with pain, tenderness, and dinner fork deformity. That is the wrist and the hand is just presented like a dinner fork. So it is very common, and it is a very common asked question also. In which fracture there is a dinner fork deformity? Treatment is again close reduction or open reduction depending upon the fracture severity of the fracture. Complications is again malunion, rupture of tendon, and Sudeikis atrophy. Fracture of scaphoid. It may be impacted, not evident early in the X-ray. Clinically, maximum tenderness in the snuff box. Treatment can be immobilization in scaphoid cast. Complication is non-union of the proximal fragment. Treatment of non-union is internal fixation. Late cases with osteoarthritis of the wrist, fracture of the metacarpals or the phalanges, that are the fingers. It is easily treated by close reduction to correct the deformity, plus plaster fixation. Usually, even plaster is not required. In case a phalanges is being fractured, it is just taped with the adjoining phalanges or maybe three phalanges together and kept in the same way for 2 to 3 weeks. Bennett's fracture. It is the fracture of the first metacarpal extending into the first metacarpal joint. That is the MCP joint. Usually needs internal fixation by K wire. This session was about the common fractures of upper limb. Hope things are clear. In case of any issue, you are welcome to put in your doubt and we'll clear it in the live lecture. Thank you so much.